Why do medications work differently in older adults? As humans age, our bodies change. This can affect how medications absorb into our bodies. Some examples include: it takes longer for your body to break down medications. A medication may stay in your system longer, so your healthcare provider will give you a lower dose of a medication for this reason. Treatment for one condition may affect another. Certain medications can change the way your body responds. This can influence how well other treatments work. Lifestyle changes. Your activity level and diet can influence how well certain medications work in your body. When you meet with a healthcare provider, discuss your daily routine, diet, and exercise so they can find a treatment option that's right for you. Healthcare providers understand the intricacies of our bodies and how they change with time. If your healthcare provider prescribes medication to you, they'll monitor how your body responds to the treatment to make sure it's safe. The Beers criteria for potentially inappropriate medication use in older adults is a list of medications that healthcare providers reference to safely prescribe medications for people above age 65. Healthcare providers use the Beers criteria as a guide to do no harm. The American Geriatric Society revises this list every 3 years. What is the Beers criteria? The American Geriatric Society Beers criteria for potentially inappropriate medication use in older adults is a list of medication guidelines that help healthcare providers safely prescribe medications for adults over age 65. Studies show that over 90% of adults over age 65 take at least one prescription medication, while more than 66% of the same group take more than 3 prescriptions a month. The Beers criteria is a list of potentially harmful medications or medications with side effects that outweigh the benefit of taking the medication. There are close to 100 medications or medication classes on the Beers criteria list. The following list isn't comprehensive, but it gives an example of a drug in each category and the reason why it's harmful. Analgesics, meperidine neurotoxicity, delirium. Antibiotics, ciprofloxacin with warfarin, increased bleeding. Anti-seizure medications, carbamazepine syndrome of inappropriate antidiuretic hormone secretion, SIAD. Antihistamines, brompheniramine confusion, cognitive impairment, delirium. Antihypertensives, alpha blockers, hypotension. Antiplatelets or anticoagulants, edoxabin, renal impairment. Antipsychotics, any stroke, cognitive decline, delirium. Anxiolytics, benzodiazepines, impaired metabolism, cognitive impairment, unsteady gait. Cardiac medications, disopyramide, heart failure. Central nervous system agents, dimenhydrinate confusion, cognitive impairment, delirium. Diabetes medications, chlorpropamide, hypoglycemia. Gastrointestinal medications, H2, blocker for delirium, worsening delirium. Hormones, estrogen, breast cancer, endometrial cancer. Hypnotics, barbiturates dependence, overdose. Musculoskeletal agents, muscle relaxers, confusion, dry mouth, constipation. NSAIDs, aspirin, more than 325 milligrams per day, ulcer, gastrointestinal bleeding or perforation. Respiratory medications, atropine confusion, cognitive impairment, delirium. Urinary medications, desmopressin, low sodium in blood, hyponatremia. Vasodilators, ergoloid mesylates, lack of intended results. When do healthcare providers use the Beers criteria? The Beers criteria is a very common tool that a healthcare provider will use if they're treating and prescribing medication to a person who's over age 65. A healthcare provider will review your complete medical history, health status, and current list of medications or supplements you regularly take to determine if a new or prescribed medication is safe for you. Your provider may modify the medication, dosage, or frequency if they determine that a medication could be harmful to you or conflict with other treatments.